Um, I'm gonna get a little artistic today. You know what is this? This is a miracle organ which every woman has. It is called as your uterus. Okay, and this is your ovaries over here. So you have about 2 sets of ovaries, fallopian tube, and the uterus. So, and here in the ovaries lies our miracle eggs. Okay, each one alternatively releases the egg, fills up here, waits for the sperm, gets fertilized. If not, it comes down. Okay, now in polycystic, what happens? If this is the ovary and one egg doesn't mature. You will see more than one egg maturing and the egg will not fertilize. So rather than one, you'll have multiple eggs maturing, rather competing with each other. Who will go out? And as a result, many eggs mature. Okay, and they have fluid collected outside which forms a cyst. This is called as polycystic ovaries, PCO. Okay, and I call it PCOS or polycystic ovarian syndrome or polycystic ovarian disease. When there are multiple ovums being fertilized and there's a fluid collected inside and neither of them actually goes down. And then you can have irregular periods, you can have irregular cycle, you can have pelvic pain, you can have increased weight, you will have fatigue, you will have acne, you can have hair loss as well, and you can have infertility. So you see, the problem lies here in the ovaries. Polycystic is basically a hormone disorder. Now because of increase or decrease of hormone, the egg doesn't mature up, and if the egg doesn't mature up, it doesn't come down. You can have irregular cycle, you can have pelvic pain, increased weight, fatigue, acne, hair loss. There are so many other symptoms, and hence it is called a syndrome because it is a collective of all of these. It's like a package. It comes as a package and hence it's called a syndrome. Now what is the root cause of it? The root cause over here, the root cause can be hormones. Okay, now your hormones over here is estrogen, or it can be progesterone. Okay, or it can be also insulin. Now insulin is treated as one of the major causes here. What we call as, suppose say you are overweight, okay, and you suffer with something called as insulin resistance. We need to understand this in order to get to the root cause. Now sometimes the treatment that the doctor gives you is to lose weight. Why? Because you are excessive in weight and you have insulin resistance. What is insulin resistance? Insulin is nothing but a hormone which is released. You take food goes into the stomach goes to the cells, right, after digestion. Now here is where insulin comes in. It kind of is a gatekeeper. Now insulin will tell, open the gate and the food will go inside the cells. If your body doesn't recognize this insulin, if you have insulin resistance, for example, now this insulin resistance will say gate is closed and hence food cannot go inside the cells, which means there will be excessive blood glucose. Okay, now increased blood glucose means they say diabetes, right? When your blood glucose is very high in the level, so it's called diabetes. So you have symptoms like diabetes because your body doesn't recognize insulin, which is the gatekeeper, and hence the food, the glucose cannot reach the cells, and you will undergo something called as increased blood glucose. Now the effects of this, it is because of this that you will have hormone fluctuation, which means you may have increased testosterone, because of which you have hair on your face or hair loss or excessive hair. Okay, and then because of this increased blood glucose, you can have increased weight, increased acne, and all those things. So let me summarize it for you friends here again. We have a set of ovaries, 2 ovaries, and these ovaries produce something called as eggs. Now if one egg doesn't mature every month and gives you in your cycle, that is called PCOS, when multiple eggs are maturing because of hormones. Hormones can be lack of estrogen, increased progesterone, increased testosterone, or insulin if you are fat. Hence the doctor tells you to reduce your weight. So now there are multiple cysts produced, there's increase in your hormones level, and then the body tells you that the food is released, you have something called as insulin resistance because you have fat, too much of cells. Now the body cannot produce too much of insulin, right? So lack of gatekeeper, insulin acts like a gatekeeper from your stomach, the food which is digested from glucose, to open the cells and let the blood glucose in. Now if this insulin or the gatekeeper is not doing its job well, it is called as insulin resistance, which will result in increased blood glucose level, and this increased blood glucose level is what is called as will result in something called as high testosterone or androgens, because of which there will be hair loss or excessive hair, increased weight, acne, infertility, hair loss, pelvic pain, irregular cycle, and a lot more. Okay, so this is where your hormones play a very, very important role in the management of PCOS or the PCOD, polycystic ovary syndrome, or the polycystic ovarian disease. Now my dear friends, the good news is it can be managed, so take a breath. Okay, all that we do over here is very few lifestyle changes in order to let your insulin regulate the normal way. Okay, how can it behave the normal way? When you are exercising. Okay, you have to maintain your exercise, very, very important, physical exercise, not just 1 hour, because that will contribute to just 4% of your physical exercise throughout the day. If you are just sitting and not moving, not doing anything, it is of no use. You have to keep yourself moving. So buy yourself a Fitbit watch or any fitness watch, count your steps to minimum 10,000 a day, and in addition do 1 hour of regular exercise, any exercise of your choice. With that you will be able to control your insulin levels. Okay, now the second thing is about your sleep. Make sure that you get regular at least 7 to 8 hours of sleep, because if you, my dear friends, are not getting proper sleep, your hormones will again be unstable. Now when I say unstable, your estrogen, progesterone, your testosterone, and even your insulin needs to be regulated only when you are sleeping properly. So once you are sleeping properly, your hormones will come back in place. Next is your positive attitude, not to get stressed. The fourth one is your diet. Now diet plays a very important role. Now I understand it is not you who want to go on junk food, or who have craving of eating salty and sweets and chocolates, but it is your hormones making you do that. So everything is a vicious circle, whether it's the insulin resistance or weight gain or cravings coming up, it's your body telling you. But my dear friends, if you are craving for any of the junk or salty or sweet, please try to avoid it, because that is going to harm you even more. Yes, it's going to harm you even more. So the easiest way is control your insulin. You can control your insulin either by eating right and also by exercising. Okay, so please keep in mind, insulin is the culprit here and you have to kill it, and you can do it. So avoiding foods which are high sugar, Now sugar means bakery items, sugar means chocolates, sugar means you can take fruits, that is natural sugar, but sugar in all hidden form is prohibited. Good. Now once you have removed the sugar, half your problem is solved there. Second thing, try avoiding any of the fried items. Now this holds true not only for people who have PCOS, but also young girls who have irregular cycle, painful periods called as dysmenorrhea. Try to avoid fried foods. Try to go on less sugar, if not no sugar, go on less sugar. Avoid sugar added foods. Avoid using microwaves, very important. Now when you use microwaves, the food which has oil content, every food has oil content, right? Even your upma, your poha will have some oil content. With the microwave, the wave will enter the smallest particle of the fat and break it and make it into trans fat. Now you would not like to do that, right? So try and heat the same food if you have to on a gas, and avoid using microwave, especially for PCOS people. Of course, microwave is bad for everyone. Try to avoid it, but very specific to PCOS, it's really bad. And no fatty foods, no fried foods. What you can have is something called as low glycemic index foods. What do I mean by low glycemic index foods? Foods which release sugar very slowly. What are those? You can have millets. Millets would include your ragi, your jawar, your barley, very good. Have a lot of greens coming from spinach, methi, very good. Fenugreek seeds are supposed to be very good in controlling your hormone levels. You can soak the fenugreek seeds. Fenugreek seeds is methi dana. You can soak the methi dana in the night and have the next day morning, or keep a stock of it like how I do, and sprout it, and you can make like a nice chutney out of it, or just eat like a sprout salad. Mix it into your sprouts. Other things that you can have for PCOS is anar. Pomegranates are extremely good for your ovaries. Okay, and munakka, dry fruit, again very good for your PCOS problems. There are many superfoods. I've given you 5. I hope you've made a note of it. From exercise perspective, I truly believe you can make the most of your exercise when you regulate the exercise with your breath. Why? Because when movement and breath is synchronized together, you not only get the physical benefit of exercise, but also you get the mental benefits of exercise. Now, mental benefit of exercise would mean reduction in your stress, anxiety levels, better sleep, better relaxation, and better calming down. Would you not like that? Yes. So here I will teach you 5 asanas. 5 asanas which are supposed to be a boon for women with PCOS symptoms. Okay. So the 5 asanas, apart from the other tips that I've given you, you can also incorporate this. I hope that helps. So I'm going to teach you very quickly some 5 asanas. The 5 asanas over here, I'm sitting on my mat, and then sit in a comfortable position. Form a diamond. Okay, like a butterfly. Form a diamond with your legs held together and bring it as close as possible to your body. Okay, bring it as close as possible, your hips out. This is called as butterfly movements. Try to do this 100 times a day. You're sitting watching movie, watching TV, do this Baddha Konasana exercise or the fluttering of butterfly movements. Very good. It opens up your inner thighs, brings in movement towards your lower abdominal area, and helps you in your blood circulation to abdominal as well as reproductive organs. So do these butterfly movements. You could do Baddha Konasana. I'll show you the side view. So you are sitting straight, hands held at the ankle joint. Slightly give a backward stretch. Exhale and bend down. Bend from your lower back, going down all the way. Go as much as you can. Some people may go here. Try to keep the back straight so that the pressure comes here, and try not to round the back. Keep your back straight and bend down. Exhale and go down. Hold there for 10 counts. And slowly come up. That's asana number 1, called as Baddha Konasana. You could do the same thing, Baddha Konasana, while sleeping. So all that you have to do is lie down, sit in Baddha Konasana where your legs are in a diamond and sleep back. This is called as Supta Baddha Konasana. Your thighs may pain, inner thighs may stretch a little bit, which is completely fine. That means the asana is doing its work. So Baddha Konasana, Supta Baddha Konasana. The next asana called as the Vakrasana. Now that is stimulating your sides. So you bend your right leg, take your other hand up, hold the ankle and shift. Hold there, 5 counts each side. So you release, hold the other side, inhale and up and stretch. So it's important you stretch the side because that's where it will stimulate your ovaries as well as the liver to produce more insulin. So that's Vakrasana. The next asana that I'm going to teach you is Malasana. One of my favorite asanas, the deep squat, which helps you to work on your inner thighs as well as the abdominal organs. So all that you do is keep your legs apart and sit straight. So that's Malasana for you. Try to make sure that the knees and toes are pointed outward. With your elbow, push your knees out. So that's Malasana, which is again very, very good, giving you instant effect to your ovaries and helping in your flexibility of your thighs, inner thighs.